My name is Taylor Bragg, and I'm a urologist with Urology Centers of Alabama. And today I would like to just spend a few minutes talking about BPH, or benign prostatic hyperplasia. But before we talk too much about BPH, let's talk about what is the prostate, where is it located, and what does it do. The prostate is generally a walnut-sized gland that is located at the base of the bladder, and the main function of the prostate is to supply nutrients to the sperm. I tell my patients frequently that the prostate is very similar to the uterus in a female in that it's very important. In fact, we can't do without it during childbearing years, but after childbearing years, about the only things that can happen to it are bad. It can become enlarged or it can develop cancer. So this morning we want to talk about the enlargement process, and that is called benign prostatic hyperplasia. So who does this affect? Basically every man, if he lives long enough, will be affected by BPH. In fact, 80 to 90% of men who live into their 80s will have BPH. BPH can be an inherited disease, but it is not exactly one-to-one in that if your father had BPH, that doesn't necessarily mean that you will have it. But most studies have shown that there is an inherited quality to it. Why does the prostate enlarge? Most studies have shown that the male hormone, testosterone, that is produced in the testicles is converted or changed to dihydrotestosterone, and there are a large number of receptors in the prostate for dihydrotestosterone. In fact, as men age, there are more and more receptors. So we know that this plays a major role in the growth of the prostate. Now, just because the prostate enlarges doesn't necessarily mean that men will have problems. So how do we diagnose BPH? Normally, we have men that come in with several symptoms that we call lower urinary tract symptoms. Now these can involve I'm getting up more frequently at night. My urinary stream has slowed down. I have hesitancy, intermittency. I don't feel like I'm emptying my bladder completely. This will allow us to start the process, which involves a careful history, a physical exam. We do a blood test called a PSA to screen for prostate cancer, and then we give a questionnaire that has 7 questions called an AUA symptom index. Based on the responses to these 7 questions, we can put patients into a category of mild, moderate, or severe symptoms. If the symptoms are in the moderate to severe category, there are other tests that we can do. We can perform a flow rate. We can look in the patient's bladder, which is called cystoscopy, or we can do urodynamics. Urodynamics measure bladder capacity, pressure, and flow. Now, if the patient is not bothered by these symptoms, they may need no treatment at all. But if they are bothered and they would like to have treatment, generally the first line of therapy is medications. And there are really 2 types or 2 major classes of medications. The first is what we call alpha blockers. There are receptors in the bladder and in the prostate called alpha receptors, and these medications block the alpha receptors. This will relax muscles in the prostate, it will relax muscles in the bladder and allow for better flow. The second classification of medications actually shrink the prostate. These would be Proscar and Avodart, but these medications take longer to shrink the prostate, and generally symptom relief may take 3 to 6 months. If medications are unsuccessful, there are minimally invasive procedures that can be done. There is microwave therapy that can be done in the office. There are outpatient laser or vaporization procedures that are outpatient procedures under anesthesia. There is a transurethral resection of the prostate, also known as TURP, where we remove tissue surrounding the urethra to open the channel and make it easier to void. If the prostate is really large, we can do an open procedure, or here at Urology Centers of Alabama, we have specially trained urologists who can perform robotic surgery that is less invasive. Any or all of these can be very effective treatments for prostate cancer. The main thing I'd like to stress is that every man over age 40 should be seen, screened with an exam and a PSA. I'm Taylor Bragg with Urology Centers of Alabama, and the thought I would like to leave you with today is if you have symptoms of decreased stream, getting up at night, or other symptoms, please seek the treatment from your doctor and ask if any of these treatments might be helpful to you.